Welcome to Medical News Network, your trusted source for the latest advancements in the medical and dental field, making your life better. My name is Mike Wittgenstein, and thanks for joining us. Today we're in Las Vegas, Nevada at the offices of Dr. Thomas Gonzalez, a doctor we first interviewed a few years back on dental implants, finding out what was new with them, what they could be used for, and how they could help you improve your life. Today we're going to find out two exciting new things. One, about dental sleep medicine, or how dentistry is revolutionizing the treatment of sleep apnea and snoring, and about a new implant procedure called All-on-4 that not only simplifies dental implants, but makes them accessible to people who before maybe couldn't qualify for them. So my advice, sit back, relax, get comfortable, because you're about to hear some life-changing information. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. First, Doc, I want to say thank you again for allowing us to come out and taking the time to educate us and tell us a little about what's going on. We are going to talk a little bit about All-on-4 dental implants later, but before we get into that, I'd like to talk to you about this sleep and CPAP and the oral appliances. You know, I have to tell you, when I started researching this, because sleep apnea is becoming a giant issue. They're starting to realize high blood pressure is it causes a wealth of illnesses and things. So it's becoming the buzzword. I started looking around for someone to talk to about CPAP. Obviously, having spoke to you before, I kept coming up on dentists, oral appliances. I would have never thought to go to a dentist. So how did you get involved in dentistry in general, in sleep issues?
I have to start off by saying that sleep apnea is a medical condition. It is not a dental condition. So before we even treat a person, they have to be seen by a physician, an MD, and they have to be diagnosed as having that. But the first line of defense is always going to be to use a CPAP. But there are so many people that are CPAP intolerant. So that's where we come in, is for these people who cannot wear a CPAP or who choose not to, and they're looking for another option. We have an oral appliance.
So how did you get into, you told me that you were diagnosed with it?
My wife said I snored, but I didn't really believe her too much. But so I took the sleep test, and it came back and said, I have sleep apnea. As a matter of fact, it said I have moderate sleep apnea. So I said, well, I know what the choices are. I either wear a CPAP or I'm going to have to wear an oral appliance. So I started looking around, trying different appliances, and I tried different appliances on myself. And then, so it sort of hit home, meaning I was using appliances. So I found one that I thought is the most effective, and that's the one we're using now. It's called.
You said to me earlier too that you weren't going to wear a CPAP.
I wasn't going to wear a CPAP.
Are there a lot of people like that?
There are a lot of people like that, yes. I've been to a lot of organizations where there's just MDs or people that fit these CPAPs, and they come up to me and they tell me that half of their patients aren't going to wear their CPAP.
You have, and we're going to meet him here in a moment. He's going to go over some sleep stuff with us. You have an associate now, a young man you brought in that you found. You teach at UNLV.
That's correct.
And he was a student there. Why him?
Well, over the years, I've always had associates working for me. But when I was teaching there, he just sort of stood out to me, meaning he was always in, I teach IV sedation. He was always in the IV department. He was always there wanting to learn. When I would invite the students to come to classes with me, and these classes didn't have to do with IV, they had to do with sleep apnea, they had to do with the implants, they had to do with restorative procedures. And he was always the first one there. He was even there before me. And then when I would leave, he was still there asking questions. He always had this urge to want to learn more and more. And so I saw that in him. He would come to my office. I'd invite the students to come to my office. And he's one of the few who did come to the office, spent a lot of time here.
All right, well, we're going to take a quick break here for just a second. When we come back, we're going to meet Dr. Stout, and we're going to have him talk to us a little bit about the sleep issues.
You're watching Medical News Network.
Dr. Stout, thank you for coming on with us. It's a pleasure to meet you.
Thank you.
Tell me a little bit about what it is about sleep and the treatments here that you really like, and then we're going to get a little bit into treating somebody for apnea. But what was it that really attracted you to this form of dentistry?
Well, first of all, helping people is what it's all about. Constantly I'm seeing patients coming in, bloodshot eyes, tired, cranky. No one wants to go to the dentist when they're already cranky, and frankly, the dentist doesn't want to treat someone that's already cranky. Dr. Gonzalez very quickly taught me a lot about sleep in general.
Now I want to ask you, all this stuff with sleep and implants, everything you do here, you made a comment to me. Do they teach any of this in school, really?
They don't really teach, well, they teach nothing about sleep. And frankly, they don't really teach anything about sleep to medical students either. Sleep is actually very, it's not taught much at all. We've gone to lots of conferences with physicians, and frankly, a lot of physicians aren't getting the training out of school about sleep. So we find ourselves educating physicians a lot.
And you get to see the big difference it makes in people's lives.
Oh, absolutely.
My understanding is, if I go to a medical or dental a sleep lab and I get a sleep study and I go to the doctor, that I'm going to get what they call, and this is actually a really nice one, but I'm going to get a CPAP.
Absolutely.
I'm going to get a CPAP. This gentleman's got the normal one on in the picture here that attaches to my face. This one's not so bad. It just goes up your nose holes, right? And then they strap you to the machine.
Yep, that's the other end.
With a tube, and you lay there, and if you want to go camping or out anywhere there's no electricity, you're in trouble because you need, it's basically a vacuum that blows backwards. A little kind of
That's essentially what it is. People, and this is becoming more and more evident, lots of very prominent people have sleep apnea. Essentially, people they stop breathing at night. They're not getting the oxygen they need when they're sleeping, and usually they have a spouse that spends all night awake trying to wake their spouse up because they stop breathing.
Because they quit breathing. Okay,
Yeah.
Show me what dentistry treats sleep apnea with. Now this, just because I want to talk about this real quick.
Yeah.
I had never seen anything like this. I'd seen the studies where they wire you all up and they hook all the wires and you go to the hospital and you spend the night and you're telling me here I take this home and this basically just wears on my forehead and I sleep at night and it'll give you the information you need?
Yeah, absolutely. This actually was featured on the Dr. Oz show as one of the top 10 best advancements in medicine. This essentially is an unintended sleep study. This is how we know what we're doing works. Okay. Essentially, our patients, after we're done treating them with our appliance, they get this treatment.
They take that home.
They absolutely take this home. This
Their own
measures
bed.
breathing, this measures blood oxygen levels, it measures the amount of apnea, it measures a lot of different factors. And we can essentially see how well this appliance is working. It's not hocus pocus.
Show me some appliances and then we're going to meet one of your patients.
Fantastic. Well, traditionally, dentistry has used what they call a mandibular advancement device. They come in various forms, shapes, and sizes, but essentially the idea is to bring the jaw forward, which then brings the tongue forward. And frankly, the tongue is the major culprit in obstructing apnea. Okay. So you'll see lots of these, lots of dentists are using these pull-forward type devices.
Okay, and then you have a few here.
Sure, we have a couple different ones here. We use many different devices. There's device for everyone. Our workhorse here is something called the full breath solution. This works on an entirely different premise. What this does is instead of dragging the tongue forward with a jaw, we essentially depress the tongue. We control the tongue at night so that tongue can't fall backwards and obstruct the airway. And we do that
so there's no hoses, no connect, just the appliance.
No, absolutely. With any appliance, there's no hoses, luckily. Now, these come in different sizes, shapes. We can bring the jaw forward. We can make different adjustments that we need to.
And they're fitted to every person individually.
Every one of these is absolutely fitted individually.
Okay, take me to this slide. I know the first one we have here, you said this is a pretty severe case.
Absolutely, this is a severe case. This is actually a good friend of ours that's a cardiologist. He knows all about this. His wife and his kids sleep on the other side of the house because he snores so severely. He has hypertension, and he's never gone to look and see if he has sleep apnea. So what we can show, I'm going to show you a little bit here.
He has hypertension. Snoring and sleep apnea and stopping breathing, hypertension, heart disease, stroke. I mean, it's related now. The reason it's becoming so big is it's related to a vast majority of things, right?
Absolutely. And we get a huge number of our referrals to our office from cardiologists. Anyone that has difficult to control hypertension immediately is being assessed for sleep apnea. Okay. So here I'm going to take you through a couple of these shots.
And again, these images were all done here.
Absolutely, yes. Okay. So this is our before treatment shot. This is a cross section, like a karate chop shot. Here you can see the teeth. This is the airway. It's essentially the size of a tooth. It's about the size of a big straw.
So he was breathing through that, or trying to?
Well, this is what he breathes through all day long. Now, when he lays backwards, everything collapses backwards, and that's where the snoring is coming from. You can see the same view, same shot. Here you can see the top jaws. This is his tongue, and it's pushed everything backwards. So this area is getting collapsed. So at nighttime, while he's snoring, he's obstructing backwards.
Okay.
Mm-hmm.
So
now this is after treatment. This is the same cross section. Here we have our appliance, and you can see here we painted the tail here so you can see it on the x-rays. Here we are actually depressing the tongue and we're controlling the tongue. We're keeping the tongue from falling backwards. And here where your tissue was being forced backwards, cutting off this area, now everything's opened. Now he can breathe passively all night long. It's eliminated his snoring and it's controlled his sleep apnea.
Okay, now we have a patient here, and I want to talk to you. Okay. You're the one that showed up with this. Don't hold the microphone up for me because I want everybody to hear you. You had a CPAP.
Yes, I did.
And you talked to me about traveling with it.
Every other week I'm on the road teaching, I'm a contract instructor teaching OSHA classes, and I have two problems traveling primarily. One is having to carry that machine with me, and when I go to airport screening, I try to carry it on because I don't want to get my CPAP lost. So they always inspect it, take it apart, keep me an extra 15 minutes while they do a sniffer thinking I've got some hazardous device, and that holds me up.
I would have to think that emotionally, just like with the teeth, that would be a little embarrassing every time you go through, they pull you out of line.
It is. And then have to carry that and then look for an electrical outlet. Hopefully I got a long enough cord they'll reach the bed in the hotel.
And you said this left you nose dry, or you were sneezing, your eye?
It caused two problems with me. One of them was I was sneezing all the time. Sneezing and blocking of my nose. My nose was always blocked up. So I saw the ad in the paper about this device and Dr. Gonzalez, and I asked my pulmonary physician about it, and he said, I've heard they've had good luck with that. You might want to try it, so I came to Dr. Gonzalez.
Okay, so that is your actual appliance.
That's it right here, and I've been, CPAP machine went back to the company 3 months ago, and I've had no problem at all.
Does
My
that
wife
cause you-
also likes it.
I
I
got-
don't snore.
So that stopped you from snoring too?
No snoring, and this works. This works.
Wake up in the morning, your tongue's not sore, you slept well?
No problem. No sneezing. No
Easy to get
snoring.
through traveling?
Oh yeah. Just
All right.
this in my pocket, and I'm on my way.
Show me what you did for him. Is this his x-ray?
Yeah, these are his x-rays.
Okay, so this was before?
This is before. Now, when we take these scans, the patient is sitting up.
Right, so if he laid down like this would actually bow down. And we can actually see the piece holding it here.
Absolutely. What I like to look at is this area here. The tongue fills the entire chamber of the mouth, and this is his soft palate and the uvula that hangs down in the back of the throat. What happens is as we depress that tongue, we actually open all of the airways open. So you can breathe better through your nose and you can breathe through your mouth. This is actually a shot of his actual appliance. You can see it's depressed the tongue. It just opened everything. Now at night, he can sleep in any position. The tongue just can't go back any further.
So you don't have to sleep in a certain position.
No. Anyway,
And I do want to ask you another question, because I did ask you this before, and I'm starting to find this out, and I think everybody, my big thing is educate yourself.
Yeah.
Okay? Make sure you know the options. I ask you, when you went for your sleep study in the hospital, did they give you or offer you an appliance, or did they just say, here you go, CPAP?
No, they just sent. They contacted a company and they brought me a CPAP. I didn't have an alternative other than the CPAP was it.
So there's probably a lot of people out there like him that, and I asked you earlier, what percentage, how many people, because I do have friends that have these. They don't wear them. I guess they'd rather die. I mean, the doctor said you're going to die if you don't wear it, but he doesn't wear it. And I said, why? He says, it's just so uncomfortable. He didn't know about it. Is this something that the medical world at this particular point in time doesn't know a whole lot about?
Well, I wouldn't say, the medical world is very open to this. Actually, the American Academy of Sleep Medicine recommends oral appliances for mild and moderate sleep apnea. That's kind of technical terms, but no, that means physicians are recommending oral appliances. It's just a lot of centers aren't familiar with the appliance, but they don't have a clinic that they can refer patients to.
So I want to thank you for taking the time. We're going to go take a quick break, and we'll be right back with Dr. Gonzalez.